All right, so in here we'll be talking about the role of lipids in acute coronary syndrome. All right, basically we'll be looking at how lipids can be able to cause narrowing of blood vessels in the heart, thereby causing myocardial infarction or heart failure. All right, so this was how what the full question was asked in an exam. All right, this was an exam question, chemical pathology in my medical school. They said that write emphasizing, okay, write short notes, okay, emphasizing the important points on the roles of lipid in acute coronary syndrome. Okay, so basically it's just like this, right? Build up of what plaques, that's the atherosclerotic plaques. When they build up on the sides of the blood vessel, you see them on the side, you can see them on the side, mostly the low density lipoproteins. So now when they build up now the space for the heart to pass, the space for the blood to pass now is actually like being narrowed. Okay, now the blood might find it hard to pass, or some blood might even clot to block the whole vessel. Do you understand? Let's talk about it now. We said that lipid plays a major role in acute coronary syndrome. Okay, so here is how lipid actually affects acute coronary syndrome. Basically, high intensity statin therapy reduces major adverse cardiovascular events, okay, resulting in better outcomes for acute coronary syndrome. This is just basically talking about the treatment, okay. But also high intensity statins lower lipids, reducing low density lipoproteins, which we actually what put it here, okay. Um, by an average of about what 44.7. All right, so now lowering this low density lipoproteins will reduce major adverse cardiovascular events. Okay, it can also reduce the risk for what myocardial infarction, and also what reduce the risk in what cardiovascular death in what acute coronary syndrome patient. Okay, that was just the whole thing that we discussed about. um you see this is a normal blood flow. You see abnormal blood flow where the blood has to maneuver through what deposited fat. Okay. So now high intensity what statins will decrease low density lipoproteins more effectively than standard statin therapy, resulting in better outcomes. The relationship between this low density lipoproteins reduction and the major adverse cardiovascular events reduction is not causal. So other factors are basically what involved. Okay. So high intensity statin therapy increases the risk of what adverse events like what myopathy and myalgia and elevated liver enzymes, right? That's basically the side effect for a drug. Okay. So that's basically the roles of lipid in acute coronary syndrome, right? But basically they just spoke about it in side to side with the drug management. All right, so that's it, guys, and bye.